Hi, my name is Evan, and I'm putting this video together because when I encountered my own Achilles tendon rupture 1 month ago, it at first didn't seem to be a whole lot of information available. Since then, I've discovered a lot, but it's sometimes requires reading through a lot of blogs to get to the information. And there are a few videos out there. One that I would definitely recommend is by a fellow up in Canada named Brady Brown, a professional football player who went through this. And by all means, feel free to research. This is hopefully going to help in your own particular journey to recovery. But going to bring up a few things that I've discovered along the way. Hopefully, it'll help you. So my own personal story: on the 6th of June, I was playing tennis. My family started playing tennis recently, and I enjoy the game. So after a couple decades of not playing the game, we went out one Saturday afternoon and weren't even keeping score. But I attempted to run forward to get to a ball, felt the classic pop, heard a sound, and as I was falling, looked back to see, what on earth I must have stepped on to make this noise, and there was nothing there. It was my Achilles tendon rupturing. Went to the emergency room that night, and they put me into a 90-degree splint. So what I mean by that, of course, is that the foot, instead of being down here at about a 20-degree angle, as it should be, they actually put it at about 90, right there. As it turns out, that's not the way to go, because if you're not going to have surgery to repair the tendon, and that's the path that I'm on, I went the non-surgical route, you want to have about 20 degrees of toe downward angle. It's called plantar flexion, to allow the tendon ends to come back into proximity with one another to let them heal. Now, it was only that way for 48 hours, probably not a huge deal, but I guess the bottom line there is don't expect that the emergency room is going to know everything about Achilles tendon ruptures. They triage you and they refer you to a specialist. So if you don't advocate for yourself and ask, if they may put you into a similar splint. So ask to get that downward angle to give yourself every benefit of that time between when you are seen in the ER and when you see your specialist. So that happened on a Saturday. On Sunday, I got to do a lot of research. So by the time I got to the orthopedic surgeon on Monday, I was pretty well armed with information. And it seemed like over the last several years, there's been a lot of work done in the area of determining what's the best path to recovery. And it seems like there's been a lot of evolution toward early weight bearing in the rehab protocol. Start to walk on the injured foot as soon as you can. And whether you have surgery or not, I'm not here to disparage surgery, but I decided to go a non-operative route because I felt confident that that seemed like a worthwhile experiment. Who knows? I may have a re-rupture, but it seemed like the data suggested that if you behave yourself, you stand a pretty good chance of having similar results as someone who went the surgical route, but without having to deal with the complications and potential infection and all that. So that's the path that I'm on. It seemed a little counterintuitive that it could heal without the two ends being brought back together with sutures, but the data suggests that that's maybe the way to go. So that's the way I'm going. So they gave me a set of crutches. The orthopedic surgeon actually suggested going the non-surgical route, so that's the way that I have gone. They gave me a protocol that said for the first 2 weeks, non-weight bearing, which is a bigger deal than frankly I anticipated it would be. Thankfully, my wife and my kids have been taking great care of me, because with crutches, you can't do a whole lot for yourself. You can't carry things because your hands are engaged with the crutches. If you have what I'll call the American style crutches that come up to your armpit, you can sort of cheat and carry things, but it's not the most stable way to get around. So for the first 2 weeks, my family took terrific care of me. And so since then, when I got to the 2-week mark, started putting a little bit of weight on it. The protocol said partial weight bearing is okay. Did that, and so I'll show you a little bit about what's going on now at the 1 month mark. I've started to walk over the course of the last couple of days. So at 4 weeks, full weight bearing on the injured foot, which has been a remarkable quality of life improvement and a big morale boost. It's a long road to recovery. It takes the better part of a year before you're back to what you consider to be normal. But at 4 weeks, starting to walk again, even though it's sort of an inchworm, little bit at a time, very slow movement. It's nice to be vertical without crutches, getting around the house, and actually being able to carry things. That's a huge, huge deal after being on crutches for a month. So I'm going to show you a few things. One being how to elevate. Following this injury, they talk about RICE: rest, ice, compression, elevation. Never really did compression. Didn't have a compression sock or an ACE bandage, and so the swelling took a while to come down, but did a pretty good job of keeping it elevated the whole time. And so I spent the majority of those first couple of weeks in the lounge chair in front of the TV with the computer on my lap, trying to stay up with work. So when you have an Achilles tendon rupture, you end up with a bit of a divot. In my case, the rupture took place about right there, and the swelling was pretty significant for the first week or so, and had some bruising on both sides of the ankle. But over the course of about a week, the swelling came down. So if you don't have one of these, by all means, go out and get one. It'll be your new best friend. One thing to note, when you ice, don't exceed about 15 to 20 minutes. Believe it or not, you can actually give yourself frostbite, localized frostbite, if you leave it on much longer than that. You want to get it cool in the tissues underneath the skin, but if you leave it on longer than about 15 to 20 minutes, you can actually, like I said, give yourself frostbite, and that's a pretty bad deal. So the way I do it, it's like a rotisserie. I'll do 15 minutes on this side, and then rotate and do 15 minutes on the back side, and for the time that I have a significant amount of swelling on the front of the foot, do another 15 minutes there, and then 3 or 4 hours later do it all over again, and did that about 3 or 4 times a day while I was doing a lot of icing. At this stage, a month out, I still do it at least 2 or 3 times a day, primarily because as I'm getting more active, I don't have any pain or real soreness there, but it seemed like the prudent thing to do. It may or may not be required at this stage. So this is the Cam Walker boot that the orthopedic surgeon's office gave to me. Inside this boot, which is set at a 90-degree angle, they actually inserted 2 heel lifts, and each of them I think has about 4 individual layers to it underneath my heel to give me, they said, I think it's 2 centimeters in total elevation on the heel, which is supposed to give me a roughly 20 degrees of toe down tilt. And I'm going to keep that in, and we're going to start taking out layers over time here in the not too distant future. One note on elevation, I usually kept 2 pillows underneath here on the recliner, but I discovered that I didn't really like the idea, well, I didn't like the feeling of pressure on the rupture area, of course, and also didn't like the idea of my calf being squished and maybe pulling on the tendon end. Wanted those to be in close proximity to each other for healing. So what I ended up adopting was sort of an angle. So I pulled the pillow up to the side and cant the foot off to the side, and so that's how I kept it elevated most of the time for the first couple of weeks. You know, there's no one answer for everybody, but that worked for me, and at least it made me feel like I was doing everything I could to let the tendons come back together again. So my physical therapist this week cleared me to start exercising. So I'm doing leg lifts of different types and lots of movements with the foot, moving it left and right, toes up to 0 degrees and then full extension, and doing that 3 or more times a day for several reps each time. And I'm able to start doing some cardio. So I happen to not be able to drive legally since I ruptured my right Achilles tendon. So what I ended up doing was I had this stand sitting around for the last 5 years or so for winter riding. Rarely used it, but it was nice to have here. So I set up my road bike inside the house. So I've got the clipless pedals on the side of my good foot, and on the other side took a pedal off of another bike, so I've got a good solid platform for the walking boot. Right now, primarily using my good foot to do most of the pedaling, and the other one's sort of along for the ride, and if I do put any pressure on it, it's only through the heel for now. But it's a step in the right direction, and so far I'm only riding for about 10 or 20 minutes at a time, but certainly feels good after a month on crutches and sitting around the house to start doing something. So there are a lot of different rehabilitation protocols out there, and mine happens to say that at 4 weeks you can move up to weight bearing as tolerated. So it just so happened that over the course of the last week I was starting to dabble in my partial weight bearing phase with one crutch and slightly increasing the amount of weight that I put on my heel as I was crutching it around, and still feeling good. So yesterday I called my doc and explained how things were, and I was curious to define what exactly weight bearing as tolerated meant. And he said that as long as it didn't hurt and I wasn't overdoing it, that I could go ahead and start walking. So here's how I walk. It may not impress anyone who's got good Achilles tendons, but if you've been on crutches and immobilized for a month, it feels pretty good to be vertical without crutches and getting around the house. So go ahead and demonstrate. Really, it's a bit of like an inchworm. One foot goes forward and the other one comes up to meet it. So I'm not going anywhere fast, but at least I'm mobile under my own power and I can carry things. If you haven't had hands at your disposal to carry things around the house for a month, it's nice to be able to get to the kitchen and bring something back and so on. So anyway, that's the walk. One of my big concerns was avoiding re-injuring the injured tendon and starting the whole recovery clock over. And so the shower could potentially be one of the most vulnerable areas depending on how you approach it. So I'm going to show you at least my approach, and I'm sure there are many others. But when I first came home from the doctor's office and I had this big boot on, I read in forums about people essentially bagging their foot. And I was so concerned about potentially re-injuring that that's what I did for the first few days. But once I got a little bit more comfortable and we got the chair, that opened up another option. So here is how I believe safely go about getting into the shower and back out, but without having to bag the boot. So chair goes in, sit on the chair. Now that I'm securely inside the tub, go ahead and take off the boot. And I position the chair so that I'm far enough away from the end of the tub that I can put my foot out in front of me and keep it pointed down to 20 degrees. If I was too close to the end, it might start to pull the toe up, and that would be bad. But keeping it out there in front of me, got a nice stable platform here. I can reach that. I've lowered the handle to the point where I can get to it, and I've got everything in front of me so I don't have to shift around and take any chances. But when I'm done, shut everything off, open this, grab the towel, dry off as I go. And once everything's dried off, boot goes on first, or depending on what I'm wearing, if it's not something that can be pulled on over the boot, I'll go ahead and put that on up to here, then put the boot on. And once the foot's protected with the boot, well, now I'm free to go ahead and stand up, but I don't get out of the tub until I get the boot back on because I don't want to take a chance on slipping. So that's that. So Achilles tendon ruptures are more common than I ever would have assumed. I hope that the information that I've given has been of use to someone who has had the injury and wondered what to consider, what to do, and maybe some of these tips might be helpful to you. In the end, there are a lot of different approaches that surgeons and physical therapists take, but the most important thing, in my view, is to make sure that you get the information that you need to make good, informed decisions. Because ultimately, if you don't advocate for yourself, you're going to be accepting whatever you get, and you may not necessarily have the best approach being offered to you. So get the information. There's a great community at achillesblog.com. It's not my website. I came across it, and I've been really grateful for having had the sounding board that community represents, and to be able to see what other people are going through, and sort of the good and the bad of how things are working out for other people. So I'd encourage you to check that out, and let me know if this information is beneficial to you, and good luck with your own recovery.